Okay, there we go. Hello, this is Daniel Luton to you, Forensic Nursing. All the things you never knew and never really thought of. Forensic nursing scope of practice and primary activities involve assessment and documentation. Our primary job is to evaluate the physical and psychological traumas of the patient. We work in response teams and spend a number of hours each month ready and on call at a moment's notice. Part of our job duties include collecting and documenting evidence about their patient's status, including attacker's hair or bodily fluids, so that it may be used in a criminal investigation. Secondly, treatment. We're supposed to be well versed in treatment procedures. There are education programs in forensic nursing that frequently include psychiatric education as well as pathological studies. In cases of sexual assault, forensic nurses are responsible for offering immediate help with the prevention and pregnancy of disease as necessary. We also provide the victim with personalized referrals for medical and psychological care. One of the most important duties of a forensic nurse isn't in the hospital, but in front of a judge, because as a forensic nurse, we are instructed in criminal law, so we are professionals in that area. We're going to be called upon to testify in a case if it goes to trial as regards to our view on the situation based on the specimens and the trauma that the patient may have gone through.
So, in regard to some of the teaching and learning strategies for the population, we kind of focus on sexual assault. Sexual assault is a crime that nurses come into contact with frequently in the emergency departments. Because of this, the emergency department nurses and physicians alike need to have the right training to handle these types of patients. The problem that exists with this is that emergency departments routinely have long waits, lack of privacy, unskilled examiners, insensitivity, improper collection, or loss of evidence. These factors aid in the continued victimization instead of healing the sexual assault survivors. So, with that being said, forensic nursing, there's a specialty in forensic nursing. She is the sexual assault, or he, sexual assault nurse examiner. So, these nurses have drastically improved that situation we were just speaking of in the emergency departments. These nurses follow an exact model of care. Within this model of care, sexual assault victims consistently receive prompt, compassionate, culturally sensitive, and developmentally appropriate services from nurses that are actually knowledgeable about victimization. A detailed assessment with sexual assault victims and evidence collection will support future legal proceedings. Better forensic evidence collection and documentation leads to more successful sexual assault prosecution. Emergency department nurses and physicians alike can learn a lot from the sexual assault nurse examiner. The emergency department is basically the medical care portal for many sexual assault victims, if not all. The emergency department followed a model similar, if they followed a model similar to the sexual assault nurse examiners, they would be doing their patients a great justice.
Forensic nursing education and training. The starting point for a career in forensic nursing is becoming a registered nurse. Once that's done, a bachelor's degree is required. It can take 2 to 4 years when passing the National Council Licensure Examination. The next step is formal training in forensics. Formal training is education in the medical forensic care of a person who has suffered an assault or trauma, such as the victim of a mass disaster or sexual assault. There are a number of courses available, both in adult and pediatric versions of the Sexual Assault Nurse Examiner Certification and the Emerging Advanced Practice Forensic Nurse Portfolio Credential. Information on both of these can be found on the International Association of Forensic Nurses website. Forensic nursing programs are available at the undergraduate and master's degree level. Undergraduate programs offer a certificate in forensic nursing for those who already hold an RN license. At the graduate level, advanced studies in nursing forensic programs can teach you about perpetrator and victim interview methods, death and death investigation procedures. That you also are taught to learn and recognize the signs of elder and child abuse. Some of the programs include clinical rotations, which allow you to hone your skills in places like correctional institutions, mental health clinics, and women's health service facilities. And in order to enroll in a master's program in forensic nursing, students usually must have a Bachelor's of Science degree in nursing and an RN license. Forensic nursing programs, like other professions in both the criminal justice and healthcare systems, forensic nurses can have many different specialties and focuses. Part of these, most of they're required to participate in a number of different activities, such as victim and perpetrator care, evidence collection, consultation with authorities, and at the very least, each of these specializations deal with these duties. Beyond them, there are other different functions and jobs to perform, such as sexual assault abuse nursing, correctional nursing, gerontology nursing, psychiatric nursing, death investigation nursing, and legal consultant nursing. There are 3 types of certifications. The highest level of certification is the Portfolio in Advanced Nursing Practice, which requires the folio assessment rather than the exam at the master's degree level. You can also take a certification exam to obtain the SANE certification. SANE A is for working with adults, SANE P is for working with pediatric victims. Some of the qualifications for taking the SANE exam is an unrestricted nursing license, 40 hours of sexual assault coursework, a minimum of 2 years of experience in the nursing practice, and practical supervised experience in sexual assault nurse examiner capacity.
So, forensic nurses bring a unique nursing perspective to the multidisciplinary forensic team. Forensic nurses have the ability to work with both the living and the dead. This is what makes them so unique from any other nursing specialty. This includes victims, suspects, survivors, and those that are left behind. Forensic nurses work in various locations, including emergency departments, medical health settings, correctional facilities, and coroner's offices. On top of that, forensic nurses have the ability to work with law enforcement agencies, medical examiners, lawyers, social workers, child protective services, physicians, and even the media. So what was really unique about or interesting about our research on this role really was the issues that are going on in an emergency department. We know all emergency departments, their main focus is to treat the acutely ill, but it's really not publicly known for the treatment of treating the forensic patient. These patients could be rape victims, elder abuse, victims of malicious crimes, or even a child that is a victim of a crime. The emergency department is the first, if not the only place these victims go for help. And the research conducted for this project, it was astounding to read so much on just how unprepared emergency room nurses and staff are when it comes to sexual assault victims. These professionals are expected to be able to preserve, collect, and potential physical evidence. Their ability to do these things correctly will have a major impact on any judicial outcomes, if any at all, in regard to this criminal activity. Another really interesting fact about forensic nursing is that we read a story about a guy who was paraplegic who dies. He died as a result to a long-term infection. Well, this original wound was caused by a gang-related fight, which was a gunshot wound. So because the original wound was caused by malicious intentions, this case now becomes a homicide. This is something, as a nurse myself, I was never taught in nursing school to know. I mean, it makes sense, but it's stuff like this that's not common knowledge to a nurse that is not specialized in that area. In this situation, the nurse or physician or whomever would need to contact the medical examiner's office with the need to be notified. There is a high possibility that new charges will be filed due to this patient's death.
Necessary skills and abilities would be situational awareness, critical thinking, good judgment and decision making, clear oral and written communication, especially when going before a judge, reading comprehension, and customer service orientation, because all in all, it comes down to the care of the patient.